It's been more than 2 months since the military was deployed to long-term care homes in both Ontario and Quebec. Today, Ottawa announced the Red Cross will take over in Quebec by the end of July. An astounding 81% of all deaths due to COVID-19 in Canada are connected to long-term care homes, and provinces are urging the feds to send them more money to fix the system. Will that happen? Pablo Rodriguez is the government House Leader, and he joins us here in Ottawa. Hi, Minister Rodriguez. Good to see you. Thanks for making time for us.
Hello, Vashi. Always a pleasure. Thank you for inviting me.
I want to start off just on this announcement today around long-term care homes in Quebec and just make sure for our viewers that we have the numbers straight. I know that you're promising by the end of July 900 Red Cross workers to supplement the military workers. I think there's over 1,300 members of the military working right now. Are they all going to be gone by the end of July? Are they all going to be replaced by Red Cross workers?
Most of them, there will be some members of our armed force that will be staying just in case at the base, but not in the long-term facilities, just in case of an emergency. But they're being replaced gradually by the Red Cross workers who will be trained and will know exactly how to help our elders. And as I said it since once, right? We'll never forget our elders. We'll always be there for them, and that's what we're doing.
I listened to your press conference a bit earlier, and it sounds to me like you're planning to have 900 Red Cross workers by the end of July, but there's not. Can you guarantee that? Because I know there is still some recruiting that still needs to take place.
Yes, well, that's what the Red Cross is doing. Actually, I met with them privately. They explained to me what their strategy, what they were doing, how they did similar things in the past. They're convinced that they're on the right path. So we're starting with 150 that will be ready in exactly 10 days from now, and they're confident that we're going to have the 900 by the end of the month. Absolutely.
If they aren't able to fulfill that for whatever reason by the end of the month, will military members stay in those homes if they need to, if there aren't enough members of the Red Cross to replace them?
Well, we'll see, but I mean, we're convinced that they will be able to deliver. And the military that are still in long-term facilities, because there's only a few that remains are in a more delicate situation. They're only going to leave those places once that facility has turned to green, right? Remember the codes red, the orange, yellow, and green. They only leave when it's turned to green, and they did that in 47 facilities across Quebec. And I want to take a second to thank our men and women from the armed forces. They did an amazing job.
I just want to be clear, though, for people in Quebec who are watching right now with loved ones in long-term care homes, should the Red Cross not be able to recruit, I know that you're confident, but we don't have a guarantee of it. Should they not be able to recruit enough people, will the military remain?
Well, they're there. I mean, many of them remain in Quebec, but not in the long-term facilities. So if there's an emergency, something that is needed, that's why they're staying in Quebec in case there's a need. But we don't foresee that need. We think that all the measures are in place to be able to do the job with the Red Cross.
Is the bill being split between Quebec and the federal government? I know the Prime Minister said today that it would come out of, I think in part at least, $100 million that the federal government announced last month for the Red Cross, but that was supposed to be for not just stuff like this. It was supposed to be in the event of forest fires, let's say, or floods, things along those lines. So will Quebec be footing any of this bill?
No, this will come from the $100 million that we transfer to the Red Cross.
And then on the question of pay for Red Cross workers, the military announced, I think it was DND last week, that Canadian Forces members who worked in these long-term homes would be paid kind of like a hazard pay or a danger pay of $78 extra a day. Will Red Cross workers receive equivalent pay?
I think that they have an hourly rate of $28 an hour, so that's what they're offering at this moment for a minimum of 4 weeks. So that attracts a lot of people, and that's why the recruitment is going well, and they think they're going to be able to deliver exactly what they expect to deliver.
I guess, though, for the members of the military who were working there, clearly the circumstances after reading those reports in both Ontario and Quebec were pretty dire that they were up against. I imagine to a certain degree Red Cross workers will be facing the same. Should your government be considering that same kind of danger pay for them?
Well, this is not something new. Like we kind of think that, oh, the Red Cross are coming and this is totally new for them. It's not. They've been working in long-term facilities in the past. And one thing very important to mention, Vaishie, all the training that has been done to our soldiers was made in big part by members of the Red Cross. They know exactly where they're going. And also the situations has changed a lot. And there will be no more long-term facility at a red condition, where they have that same kind of dangers and needs and this and that. Things have changed in big part because of the soldiers, also big part because of the great work done by the people in those facilities, by the government of Quebec. So we're facing a different situation.
The Chief of Defense Staff today also said that 55 military members who tested positive for COVID-19 could have been asymptomatic before they began their deployment. What kind of testing are you going to do for Red Cross workers?
That it depends on the what is planned for them at that level. You would have to ask the facilities in the government of Quebec. They provide those tests.
So you're going to be footing the bill for the Red Cross workers. Are you going to make sure? Is the federal government going to be making sure that they get a certain level of testing? Just because, based on the experience of the military, right? If they were asymptomatic and they didn't know they had the virus, that would lend itself to the idea that these workers should be tested well in advance of coming to these homes.
But Vaishie, we've learned a lot. The soldiers have learned a lot. We have learned a lot, and some of the people that we're bringing there, members of the Red Cross, are experts in that, experts in providing safe environments, and they actually did the training for the arms for our soldiers. So they know exactly where they're going.
So the testing and things like that are out of the purview of the federal government.
Exactly. It's there. It's done locally based on what's in the I don't know how you say that, planned by local authorities.
Right. Okay. Let me ask you about the bigger issue of long-term care, because that is something that the Prime Minister has certainly received a lot of questions about, not just today, but yesterday as well. And yesterday he specifically said that it was provincial jurisdiction and the provinces that failed our seniors. Did Quebec fail its seniors?
I think we all, in a way, also our society failed our seniors in a way. If you look at the death rate, if you look at what our seniors are going through, what they went through, what they're still going through, I don't think it's acceptable in a society, in any society, and even less in a society that that has the means, the capacity, the health system. And I think we all have to do better, and all have to work to make sure that this doesn't happen in the future. And we'll do that collectively.
Respectively, though, the Prime Minister was very specific. He said it's the provinces who failed our seniors. Do you agree with that assertion?
No, I think, again, it's the same answer that I'll give you. I think the whole society failed in a way, our seniors. And we all can do better, and we're all going to do better. And we all learn from this terrible experience. And I'm sure that things will change. Not I'm sure, things will change.
In talking about that idea of things changing, a lot of different conversations going on about what role the federal government will have in that, given that it is provincial jurisdiction. I know there's a big ask of the Prime Minister and of your government to increase federal health transfers following the pandemic. I think the Prime Minister has agreed, according to premiers, to at least speak about that this fall. If that does happen, if there is additional funding from the federal government to provinces for long-term care, should there be national standards for that care attached to the money?
There's discussion actually with the provinces. I cannot answer that questions like that. I mean, there's ongoing discussions every week, and actually, you saw it last night. The Prime Minister had his 15th meeting in a row with all the premiers, and there's ongoing discussions about it. We have something to say, definitely, but the provinces are the ones managing the system, so we have to discuss with them. But we all want the same thing, which is to change things, to improve lives for our seniors.
But do you have a position yourself as an MP in Quebec about whether or not if the federal government does give more money, there should be national? And I'm asking because in Quebec they're not the government there is not in favor of attaching strings to that money, and so I want to know where you stand.
Yeah, because what the Quebec government says is that we manage the system, and they're right. They do manage the system like the other provinces too. So what we're doing is discussing with them. This is a federation, right? Sometimes we agree, sometimes we disagree. The important thing is to be around the table and keep discussing, and this is what we're doing with them.
So you don't have a position on whether or not there should be strings attached?
It's not important what I think personally. I think that the discussions have to keep going, and you know, at the end of the day, what governments want is the same thing, right? What the Quebec government, the Ontario government, or the BC government, and the federal government want is that this situation never happens again, and that we want a better future for our seniors, and that will happen.
Okay, I'll leave it there. Thank you so much, Minister. I appreciate your time.
Thank you, Vashi. Bye-bye.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.